Essent Spa. We're doing the PRP Advanced Vampire Facial, and Jen has already done the subcutaneous injections. I chose 3 areas that I wanted, and you can see a little bit of the leftovers of the injections, and now we're up to the micropen. And here she's dropping the PRP right onto my face.
I rubbed it in.
And she's injecting with the micropen. Totally comfortable. I actually don't even really feel much of anything at all right now. Slight sandpaper sensation. And this is platelet-rich plasma and platelet-poor plasma that's being pushed into my skin. The goal is to stimulate collagen formation, even out skin tone and texture, help treat sun damage. You guys may have seen it before with Kim Kardashian. They make it really dramatic, all bloody and everything, but you can see that it really is not. I'm actually going out tonight for Best of the Mainline Physician outing, and I am doing it even though we're going. So you can get an idea. Most people, I tell you, give yourself a little recovery time, but everyone knows I'm crazy and I just don't mind going out immediately after. But you're going to see that my skin's going to look glowing and fine after the whole thing. So Jen did subcutaneous injections on my forehead, on the corners of my eyes, and in my nasal labial folds. And then we had a little extra PRP because she also treated my cheek area. We also decided to do a little bit of eyebrow stimulation for hair. So trying to thicken up my eyebrows. So she also did some subcutaneous injections in my eyebrow area. Very comfortable procedure, quick and easy. The whole thing's going to take us about 50 minutes. The PRP is known as liquid gold, and if you can see it in our hand, Jen, can you show everyone what it looks like?
Sure.
It's going to be a gold colored fluid. So it is not bloody. And at the end, we're going to post at the end, we're going to post a photo. We're going to do the Hollywood style photo of what it would look like with the blood all over your face and why people call it vampire facial. But that's really just a Hollywood stunt. It really has nothing to do with the procedure itself. Really comfortable, really easy. Results. You're going to have 2 stages of results. So you're going to see results immediately after from the plumping effect that happens just from the PRP being infused. As that plumping effect goes away, you're going to start stimulating collagen remodeling. Collagen remodeling takes anywhere from 1 month to 6 months. Some people even say they see results developing 1 year after. In general, I tend to recommend procedures be done in series. Again, this is a fractional treatment. So we're going to increase and do this procedure as a series procedure once a month for 3 in a row. You're going to love the results, and you're probably going to want to continue to do this semi-annually. You can also mix it up with some laser procedures as well as some of our other offerings. But this is, again, the Advanced PRP Vampire Facial. Now our goal is going to be to get a flushed red sort of look. You're going to look afterwards like, I tell people, you went skiing and you have a little bit of that windburn, sunburn combination going on. You don't look like you had work done. No one really will know what you did. They may say, oh, did you go to the beach? Did you get a little sunburn? That's about it after the whole thing. So it's a pretty quick recovery. You may feel a little bit of irritation afterwards to your skin, but we do recommend that you use the intensive repair serum on your skin twice daily for about 3 to 5 days. And that really takes away all the irritation. You can add it even more frequently if you feel like you need it, but usually most people are comfortable when they do it twice. And as you can see, there's a multi-pass approach with the micropen. which is driving the PRP through the skin and into the deeper layers of my tissue. Now Jen's going to assess how it's responding, and she may repeat this again at a deeper level. As a look, that looks. I feel fine. It's really quite comfortable. If you want to go ahead and do a little bit of a deeper treatment, you can.
Sure.
We have Brittany here, who's from Eclipse Micropen. She's actually filming for us. Brittany, do we have any comments going up?
Gabriella said, what's that? She must have joined us late. If you want to...
Oh, okay. Gabriella, thanks for your comment. So what we're doing right now is Jen has actually drawn blood from my arm, and we've put it in our special tubes that are designed to separate out PRP, which is platelet-rich plasma, from the rest of your blood products. And people ask, why are you doing that? And that's because platelets are known to contain a lot of growth factors and other elements that actually stimulate your stem cells to produce collagen. And so what we're doing right now on my face is we're driving the PRP into the deeper layers of my skin so that we're getting past the barrier. Remember, your skin is like a barrier, it protects you. So we need to get deeper past that barrier and into the tissues of my face to push that growth factor in. And so we're trying to, again, stimulate collagen. Now the micropen, as a lot of you know, also is great for skin texture, pore tightening, and overall smoothing of the skin. But the PRP is sort of an advanced technology that's going to help with fine lines and wrinkles and sort of stimulate your skin. So anyone who has any questions, post them while we're going, and I'm happy to answer them. And Jen's going to continue to treat my face. So she already did subcutaneous injections of the PRP, and again, she did those in my forehead, she did them in the corners of my eyes, she did them below my eyes, she did them in my eyebrows, and she did them in my nasal labial fold areas. All of that's done to stimulate collagen formation, giving my face a more youthful appearance. And I apologize, I do have some breakouts, just hormonal. Everyone knows you get those. So part of the redness that you're seeing on my cheeks actually has nothing to do with the procedure. It's just I'm having my own issues going on, and everyone knows you get them. So, but yeah, it's totally comfortable. We use a topical anesthetic. I feel almost nothing to a slight sandpaper sensation. It really is comfortable, easy. Really no big deal at all.
How are you tolerating everything?
Fine. I mean, it's really quite comfortable. Now, another thing that we love to do is lip stamping. So February we talk about with Valentine's Day, focus on the lips. So Jen will show you a lip stamping. We're going to go at our lightest setting, which is our 0.5 millimeter setting on the PRP. And then we're just going to do a stamp, placing it on each area of my lip. That plumps and gives a little bit of rejuvenation to the lip. You'll see it immediately after. And again, that effect develops over 1 to 6 months. So the short-term effects happen right away. And then as collagen is stimulated, you develop it over 1 to 6 months. So she'll do that in a little bit. She's now seeing around my lip.
Lisa has a comment. She said, how many treatments does it take?
Sorry, Lisa. So thanks for the comment. So basically, we really recommend these types of treatments are what we call fractional. And as you can see, even though she's doing multiple tests, the device does not tear up my skin or treat every area of the skin. And so we have areas of untreated skin surrounded by areas of treated skin. So the benefits of a fractional treatment are that there's a really short healing time, and I'm going to be better and look fine even later tonight when I go to the Top Doc Award ceremony, which is happening tonight. So we'll take some photos there so you can see my face, but it's going to look fine tonight. But the downside is that you're going to do multiple treatments. I usually tell people with micropen 3 treatments is where you're looking to be at. I say 3 treatments, 1 month apart. Let's see where you are. Most people are happy at that point. They're going to want to do sort of a booster maintenance type thing annually. Some people semi-annually. It really is all up to you, depending on the level of results and your budget. So people love it. It's really not uncomfortable at all. I'm relaxed. I'm enjoying it. I would not have a problem doing this every month if it makes me look younger and look the way I feel. You want to show that lip stamp?
Mm-hmm.
Okay, so everyone, here comes a lip stamp.
Do you feel like you need more PRP?
No. You can. Well, I can't. My lips are completely numb.
Okay.
We use a topical anesthetic. I feel almost like I'm at the dentist. Like, I'm not drooling, I hope, but but yeah, my lips are numb. This will not be uncomfortable at all.
Would you like your upper?
Yeah, do both.
Okay.
Yeah.
I'm ready.
Yeah. And that's it. It's done. Now, this almost gives you like as if you did an injection in your lip. Your lip does swell a little bit, so it's an alternative, a natural alternative to fillers on your lip. I think that fillers are a little bit more dramatic, but if you are not sure whether you're a filler person or not, this is a great introduction. It also can be used in combination with filler because, again, the PRP works in a different way. Filler, we're putting in hyaluronic acid in. The PRP is stimulating your own natural collagen production. So 2 different mechanisms that are going to give you the same type of result. So some people like to combine them, especially if you're looking for a lot of volume in the lips.
I'll just put the remainder of it.
So right now, yeah, Jen, you can tell everyone what you're doing. She's taking the leftover PRP that we have left over from the procedure, and she's using it as a mask. So right now, my skin is opened up with microchannels from the micro pen. So a mask that I would put on normally that would have some effect is now enhanced by putting the PRP all over my face and allowing that PRP to now seep in through those microchannels. So we drive it in during the procedure, and then as we're finishing the procedure, we allow it to seep in. Now, once this is getting towards absorption, Jen's going to take our intensive repair serum and apply that on top to sort of seal in the whole procedure. And then I'm going to go home and I'm going to apply it again tonight before I go out. I may apply it one more time before I go to bed, and then I'm going to put it on tomorrow morning and then twice daily for the next 3 to 5 days. So I hope if anyone else has questions, feel free to post away, and we will answer them afterwards. If you'd like to book this procedure, you can visit our website, essentspa.com, and look under our PRP Vampire Facials. And it's divided into an introductory facial, which would just have the micropen that you saw, the advanced facial, which will have the subcutaneous injections plus the micropen, and then the last procedure, I can open my eyes, she's done. Yeah. And the last procedure is going to be the facelift, which is going to have your deeper injections with our French cannulas, the subcutaneous injections. We're going to mix the material with actually Restylane, so you get 2 syringes of Restylane there, and that is the Cadillac of PRP. So it's really all up to you. We're happy to customize a procedure for what your needs and wants are. So any questions, ask us. We're always available. We always have professional staff answering the phones who can clearly describe all of this. And if you want to talk to me, post on Facebook. I'll write back to you. Thanks.